Good morning, everybody. My name is Maurizio Taramasso, and I have the pleasure to be here with Dr. Alkhouli from Mayo Clinic. And we are going to talk about a really important study that they recently conducted. And Mohamad, can you maybe introduce ourselves, why you did this study, and which were the main endpoint that you wanted to look at?
Yeah, absolutely. Thank you. It's a pleasure to be with you today. So we're going to talk about the role of edge-to-edge repair in cardiogenic shock patients. The reason why we were motivated to do the study is, as you know, cardiogenic shock remains associated with significant morbidity and mortality. Not a lot of interventions have shown benefit in reducing those bad outcomes. And we know that a lot of those patients, up to 20%, have significant mitral regurgitation. So we know all of that, but we don't know if intervening on the mitral regurgitation is helpful. And therefore, we decided to leverage a very large data set, the TVT registry, to address that question.
So a real important clinical question is going to be addressed. Which were the main findings of the study?
So the study spans about 9 years, from 2013 to 2021, included about 3,800 patients who had cardiogenic shock and underwent edge-to-edge repair. And we looked at two main things. The first one was, what's the rate of device success at 30 days? And that is reduction of MR by at least 1 grade for the final grade of 2+ or less. And the second one was, if you achieve device success, does that impact mortality and heart failure hospitalization at 1 year? So what we found is that, yes, the device success is fairly high. Up to 85% of patients did achieve that definition of device success at 1 month. And then if you did indeed achieve device success, your 1 year risk of mortality was actually about 20% lower than those who had device failure. So a number needed to treat of 5 only. So it was a fairly impressive signal of improvement.
Great, impressive. And how do you think the result of this study will impact on our daily clinical practice?
You know, sometimes we get these patients that, in your practice, and you wonder, are you going to impact their outcomes by subjecting them to a relatively complex procedure? And this data provides reassurance that, first of all, you could achieve success, a similar amount of success that you would achieve in other patients, non-cardiogenic shock patients. And second is, you might be impacting their mortality at 1 year. So it's reasonable to consider. Granted, it's observational retrospective data, we still need randomized trials, right? It's hard to conduct in cardiogenic shock patients, but fortunately there is one actually, it's called Capital Minus, that is a multi-center Canadian trial that will start soon, so hopefully that will inform us further.
Great, thanks a lot. It was a really nice and comprehensive summary, and the manuscript is going to be published on JACC, I think.
Today, yes.
Today, simultaneously to the presentation. So.
Yep.
Great. Thanks a lot.
Thank you very much.